Monitoring the increasing number of COVID-19 infections in South Africa. Just in the last reporting cycle, there'd been over 16,000 new cases. The day before that, slightly over 11,000. Let's take a look at the current COVID-19 situation in the country. Professor Mosa Moshabela, who's a Professor of Public Health and Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Prof, a very good evening to you. Thanks indeed for your time. So the numbers keep rising. Should a stricter lockdown be on the cards?
It's an important question, Griselda. And I think what we have seen so far in South Africa is that the modeling that was done to sort of project what the fourth wave might look like, did not use numbers of infections or cases. It relied a lot more on hospitals and death and what might happen to hospitals and death. So my sense is that South Africa has shifted a little bit more to focus on the severe disease and hospitalization to assess the burden of the fourth wave rather than just look at the cases and infections. What we are seeing is a situation where, in my view, South Africans, are expected to contain infections and cases sort of themselves, mild cases themselves, but the state will probably provide support in terms of how to deal with the burden of severe disease and hospitalizations. So I doubt that the lockdown would be decided purely on the number of cases.
All right, but would it be likely, though, that we might see some more stringent measures, in particular because we head towards the festive season? We're going to see quite a lot of movement taking place. Many people will be going home to visit their families, wanting to spend Christmas there. And already when we see the numbers at over 16,000 new infections, that was the last reporting cycle, certainly that should be worrying for the National Coronavirus Command Council.
Yeah, it's a good question, but I don't imagine that, government could move in the direction of restricting travel between borders or restricting gatherings in open spaces. If anything, they are most likely to restrict travel, gathering indoors, if any restriction. And I think that for any further more strict restrictions to happen, in my view, I think that we have to see a burden on the healthcare system. If we don't have a burden on the healthcare system, my sense is that the policy direction we are seeing is that the government will kind of risk absorbing the shock of cases, but then monitoring the severity of disease. There is a sort of divergence at the moment that, we might be seeing high cases but low hospitalization.
Yes.
And that requires a little bit more nuanced approach.
Absolutely. That's what we're hearing as well here in Gauteng, also indicating that hospitalizations are far less this particular wave. We're also starting to see an increase in the number of admissions of children under the age of 12. And according to Chris Baragwan at the hospital, for example, they're presenting moderate to severe illness. Do we know anything more about why this wave is having such an impact on the younger ones?
Yeah, other than the fact that they are the ones who do not have vaccination and that this Omicron variant seems to be causing an increased number of reinfections than the previous variants. We don't know much more. We're still waiting for the clinical data to see why we are having high numbers of these children. I should say that, for me, in as much as the health system in South Africa is sort of willing to absorb, or the policy really is willing to absorb mild cases, even if it's children or adults. Yeah. I'm a little bit more worried about the effects of that long term, especially because we haven't really confronted the problem of long COVID. So in these children, we're going to have to, they may recover quickly with mild to moderate disease, but we're going to have to think about the potential impact on long COVID, as well as long COVID in the people who are getting infected, even as adults, especially those who are not vaccinated, even though they may not necessarily be admitted to hospital.
Prof, that was going to be my next point. I mean, I understand a lot of people are presenting those mild disease symptoms and don't at the time, of course, put a burden on hospitals. But as you mentioned, there is the issue that is referred to as long COVID. How much of a problem is this?
It is a problem. I mean, at the moment, we only know that it's about 20%, and some studies are showing that, certain symptoms can persist in up to about 40, in some cases up to 50% of cases. We don't really know. Somewhere between 20% and 40% is what we are looking at. And so we have to make sure that we don't ignore the importance of preventing infection and even protecting people from mild disease. Otherwise, really, we're going to have to think about the delayed burden of long COVID, in my view.
All right. We appreciate your time. As always, Prof. Thanks indeed for joining us on The Full View. Professor Mosa Moshabela, who is Professor of Public Health and the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.